off, and that's the sinus in there. And they all kind of intersect at the ethmoid. So the ethmoid is sort of the crossroads of all your sinuses. So, like the ancient trade routes, you know. And so there's at least 9 bony articulations with the maxilla. I think we went over all those yesterday, right? So they articulate with each other. They articulate with the palatine, which we haven't talked about yet, so we'll review the palatine in a second. They articulate with the vomer, right? With the ethmoid, the zygoma.
With the palatine?
Yeah, in the palatine. And then there's these little bones inside the nose that form the inferior concha. So the middle and superior concha don't have bones. They're just soft tissue structures, but the inferior concha actually has a bony skeleton to it, and that's these bones here. And then they articulate with these nasal bones, obviously, and with the frontal bone. So, and then there's 8 maxillary teeth on each side, so there's 16 teeth total in the upper jaw. And they consider that it articulates with the mandible through the teeth. So when you close your mouth, each of your teeth is an articulation. One way of thinking about it, huh? So, and there's a very open sutures. But so it's a busy place. It has a enormous innervation to it, and it's the uppermost extent of the 5th chakra. So it's still included in part of the avenue of expression and 5th chakra issues. So sinus issues have a lot to do with speaking up, and a lot of main issues with sinus is needing to say something to somebody, but it's not safe to say it to them. It's a very, very common finding in people with chronic sinus. So they either have like an overbearing spouse or an overbearing boss or something, and it's not safe to say what they need to say, or they'll get punished for it. So there's 11 different muscle groups that attach to the maxilla. I don't think we'll go into all of those, but it's obviously your cheeks and your soft palate and a lot of your swallowing muscles and that kind of thing, all go into there. But the most important are the lateral pterygoids, the masseter, and the buccinator. So buccinator is your cheek. Masseter is the main chewing muscle. So when you put your finger on your cheek and bite down, that's the masseter. And that big muscle on the side of a horse's face, that big thing, that's their masseter muscle. You can imagine how strong they can bite down. And then the lateral pterygoids, these are called the pterygoid processes, and the lateral pterygoids are what moves your jaw from side to side. And they also manage that dyspnea PMJ, and that's why it's so important in cranial elective to work with the PMJ, which is a common problem for people, right? It's so common that when the alternative medical community latched on to the idea that people have TMJ problems, they started attributing everybody's issues to TMJ, and so the insurance company's response is that they don't cover anything to do with the TMJ now. So people with legitimate TMJ problems don't get it covered, so which is a weird response, right? But that's what they do. So this bone is fairly flexible, and it's a compression dissipator. So when you bite down, and you're chewing, you bite down, those compressive forces get sort of dissipated up through this bone, so they don't get transmitted up into the frontal bone and stuff. And we talked yesterday about what Sutherland called the speed reducers, which really, I'm not sure why he named it that, but I think what he was trying to say is that they help to isolate the facial bones from the cranial bones, so that they can move somewhat independently. And so the three speed reducers are the ethmoid, the zygomas, and the palatines. And if you look, those are the transition bones that articulate between the maxilla and the sphenoid and frontal and those bones.
So it's the bones themselves that are the speed reducers? It's not like the mucosa or the...
Yeah, it's how they articulate, the bones themselves, yeah. So sinus problems are the most common reasons, at least in the United States, one of the most common reasons that people seek the help of a practitioner. And I think cranial work has a lot to offer people, especially with chronic sinus issues. Because if the sinuses can't drain, they'll get infected. And if the motion's inhibited, then things don't drain as well. So same thing with middle ear infections and that kind of thing. So the palatines are interesting bones. They're fairly complicated in shape, and they're stuck on here, so you can come look at them. But they form the back part of the hard palate, and they literally are washers between the sphenoid and the maxilla, and they articulate with the pterygoid processes, and they move mostly in harmony with the maxilla, and so most of the articulation with the sphenoid moves quite a bit more than this articulation does. And but they're interesting bone because they're present in the oropharynx, they're present in the nasopharynx, and then there's a little piece that's present in the orbit. So they go all the way from the orbit to the mouth, up through there. It's pretty interesting.
And you're talking about the pterygoid processes?
I'm talking about the palatines.
Okay.
Yeah. And so to find the palatines, what we do is we go down the biting surfaces of one side with your index finger. As soon as you get to the back molar, you just drop up onto the hard palate, and your finger's right on it. And then you do the other side for the other. As long as you keep your index finger in contact with the salveolar ridge, you'll pretty much be on one of the palatines. And then yeah, so you come down like that, and then just drop your finger up onto the hard palate. And then to treat it, your upper hand is now sort of on the coronal suture. So you let go of the sphenoid, move your hand up on the coronal suture, and you're beaming energy through it, and you're trying to push it up like pushing a button, and then moving it laterally, and then bringing it back medially and down. So it's like moving it up, over, back, and down. And this is how you treat it. And it seems like most everybody's palatines yesterday moved pretty easily. Nobody would seem to be hanging out on them for a long time. So sometimes you can be on somebody's palatine for 15, 20 minutes. So get in a comfortable position and you go to work on the palatine.
And this model here,
Huh?
this is the, okay, so this is the hard palate here, this is the medium and the soft. The palatines are not these two?
Yeah, those two back there.
These two back here?
Yeah.
The palatines.
They really make a distinction on that model.
Yeah.
So the soft palate is back posterior to the palatine.
Posterior to that, okay,
Yeah.
so kind of opening into where the sinuses drop. Or,
Yeah, so if you take your tongue
okay.
and run it out along your hard palate, you can get to the end of the hard palate and you feel the soft palate. You're already off the back of the palatines here.
So let's see.
And then you can go back. Now some people have a big kind of growth on the suture of between their maxilla, and that's called the vellus palatini. Have you between nose and people. They kind of come down in your mouth. I'm not sure what that is exactly, except it's like a gall on a tree, side of a tree or something. But some of them can be pretty big. It's like a big bony growth down in here. But those folks, it may be a result of a problem with the movement of the suture response to that. So
when you're working on the molar itself with the two fingers, you're working on the sphenoid, and when you come in
no, on the maxilla.
On the maxilla, and then when you bring your fingers in just medial to those same molars, you're working on the
Palatine. Yeah.
So this is the maxilla.
Yeah, so this, you're working the maxilla when your fingers are like this. If you take one finger in and drop it in, then you're on the palatine.
So where's the one where we learned the internal for the sphenoid? What was that? Not this weekend, but last weekend, we were working on in the mouth here on the sphenoid. You remember we had a finger on the when we did the southern toe?
Oh, that's when you put a finger in the cheek and on the player.
There's another one.
We did the
Sutherland grip, but that was to work this area. That's to decompress this whole thing from the sphenoid. If you use a Sutherland grip and pull on it,
okay.
That would be to treat a compression of the palatine maxillary. Yeah. So last time we were just doing a gross decompression of this thing. Now we've got more details to it.
And this thing was the
This whole unit here. Yeah. So this unit is made up of, and the ethmoid should be stuck on here too, but this is a whole functioning unit in most people. And have you heard of Lefort fractures? Different Lefort fractures. That's where these bones get broken off of from the skull. So I had a patient when I was in Maine. He was an old guy that was working. He was subcontracted to Georgia Pacific, and he was out in the woods cutting down some dead trees that had been killed by some kind of bark beetle that was killing all the trees up there. And he heard a crack, and he looked up, and got hit by a branch that was falling, and it hit him right on the bridge of the nose, and it broke the bones off of his skull. It knocked him out. Of course, he was standing in 3 feet of snow, and he was 3 miles from the road. And his wife was there with him, saw it happen, and she couldn't get the snowmobile started. So she picked him up and carried him 3 miles to the road, and put him in the pickup truck and drove him 60 miles to the hospital. And they wired it back on. But also, when it hit him, it popped a disc in his neck. He ended up with chronic pain from that. Yeah, tough people out there. She packed this guy. She was in her 60s too.
Wow.
She
had strength from somewhere else. That's right.
Yeah.
That's some deep love right there.
Yeah. Yeah, they were cool. The owner of the property where we lived had hired him to mow our fields because we lived on 250 acres, and you have to keep mowing the fields or they'll grow in with trees, right? But then he couldn't do it because he couldn't run he had too much radicular pain after he hurt his neck to run the tractor. He was going.
Anything effective that you know of to get discs to go back in?
Yeah, now I would have been able to help him a lot better. But traction is one of the best things for both lumbar disc and cervical disc.
Traction? What's traction?
Where you?
The machine.
Well, actually, one of the best ways to do traction on the neck is, I think, to get you know those square pillows people put on their couches that are fairly firm, and you put that under your shoulder so that the edge of the pillow hits right on your occipital protuberance, and then the weight of your head trying to go back will pivot off of that, and it'll put a longitudinal pull on your neck, and you can lay there on that thing for a long time. So the traction, the longer you use traction, the more effective it is. So when you do, they have this thing that clamps in the door jamb and comes down and puts a strap on your head, and you hang this weight on it. But I've had that hurt people's jaws, and you can only do it for 15 or 20 minutes at a time. You get sick of it, and bored or whatever. And but with the pillow, you can fall asleep on it and get hours of traction.